Now I'll discuss about the patient counseling using different counseling aids or devices like meter-dose inhaler with spacer, and I'll then discuss about rotahaler. So first, let me discuss about meter-dose inhaler without a spacer. When the patient starts using the inhaler, it is important that he or she should check the dose counter to see if the medicine is available. And if the dose counter says 0, it is mandatory that the patient should not use it. This is important, because if the dose counter says 0, inhaler will be empty. And if a patient is ready to use the inhaler, prepare the body by sitting or standing up straight. Then open the cap of the meter-dose inhaler. Shake the inhaler before use so that the propellant and drug get mixed. It's very important to prime the inhaler to see whether the inhaler is having any block, which avoids the entry of drug into the respiratory tract. So prime the inhaler if before using it, especially if the patient has not used it for a while. It's very important to prime it. Or if the patient is using it for the first time, this step is very important. Then once after priming actually means just pressing the canister of the inhaler and allowing one dose to come out of the inhaler to make sure that the inhaler is working and there is no block in the drug coming out. Okay, so after doing this, breathe out slowly and deeply all the way from the inhaler, on the way away from the inhaler, and never breathe into the device. Then tilt your head slightly and put the mouthpiece into your mouth between your lips and close your lips tightly around the mouthpiece. While closing the lips, make sure that you do not bite the inhaler. It's very important. It's just to place it between your lips, not to bite it with your teeth. And start breathing in deeply, and once you start breathing in deeply, press down firmly on the top of the inhaler, that is the canister, to release one puff of the medicine. Keep breathing in slowly through your mouth till 3 to 5 seconds till your lungs are full. Tell the patient to hold breath approximately for 10 seconds by just counting from 1 to 10. Finally, breathe out slowly through your mouth. If a second dose is needed, wait for 30 seconds or to 1 minute to take the second dose. This step is very important. That is, if the patient is using a steroid inhaler, it is very important to rinse the mouth of the patient with the water and spit it out. Why? Because steroid inhalers, if are used for a long time, can lead to some side effects, because if the patient is using the inhaler, there are chances that minor amount of a drug may get deposited on the mouth wall and the throat. So it's very important to rinse the mouth after using the inhaler, and so that this drug will not, the deposited drug will be removed from mouth and the throat. Rinse it, rinse, and after that, after rinsing, spit the water out. Don't drink the water. Okay, spit the water out. So, long-term use of steroids or steroid inhalers may sometimes lead to means as I already discussed, deposition may happen, and this ultimately, if it is getting deposited for long number of days, what happens is like there are chances for side effects like candidiasis, coarseness of voice, as well as dysphonia, that is there's some reduction in the sound that is coming from your throat. Okay, so the person may sound will be completely nil sometimes, rarely. So to avoid these side effects, actually we are telling the patient to rinse the mouth properly. And the patient can check the inhaler's instructions to the right way to usually remove the medication canister from the plastic holder, that is a step, and rinse only the holder with warm water, not too hot water, just a lukewarm water. Allow the holder to dry perfectly overnight, and that is it, and use it again. The metered-dose inhaler should be stored in cool, dry location and not exposed to extreme cold or heat. Next, we will be discussing about how to use a metered dose inhaler with a spacer. Actually, a spacer will increase the easiness of using an inhaler, because as we already discussed, it is very important to have a coordination during inhaler use. That means once the canister is pressed down, simultaneously the patient is supposed to inhale slowly and deeply so that the drug will go to the lungs. But if that effort is not proper or the coordination is not proper, there are chances that the drug may get deposited on the mouth wall and throat, as I already discussed. So, to make easiness or to avoid the extra effort the patient has to take while doing the coordinated breathing, spacer can be used. Spacer can be attached to the metered dose inhaler. So in that case, if the spacer is used, there is no need for such a coordinated effort, because the spacer, the drug once comes out of the inhaler, it will go through the spacer uh, rather than getting deposited on the mouth walls. So go to the spacer, and if it is getting there is a time for once the inhaler comes out of the inhaler, there is a time for the drug to reach the mouth, because spacer is in between the inhaler and the mouth. So there are less chances for the deposition, since the patient will get some time to start inhaling during the time with which the drug comes from the inhaler to the mouth. So there's a time gap. So there is no that much effort is not required in the coordination of canister pressing and inhaler intake through breathing. So, but the spacer is it's very difficult to carry the spacer all around, because the patient sometimes have to go for traveling. In such instances, also the patient is supposed to take the medication 2 or 3 times a day. So, it's maybe very difficult to carry the spacer wherever the patient goes. That part is there, and also it is bit costlier than the inhaler alone. Okay, so that is the demerits of that. Anyway, it is very easy for the geriatric patients to use the inhaler with the help of spacer rather than using inhaler alone. Also, pediatric patients may be using pediatric mask rather than using spacer. Uh, uh, for avoiding the problems of using inhaler alone. Now we'll go to involved in the use of inhaler with spacer. As I already discussed, in the case of inhaler, check the dose counter to see that if the medicine is available, and you don't use if the dose counter says 0. Same procedure as in the case of inhaler. Prepare your body by sitting or standing up straight. Open the cap of the meter dose inhaler. Prime the inhaler as I already discussed in the case of meter dose inhaler alone. And next is like connect the two halves of the spacer. Once the inhaler is primed, two halves should be connected. We may be separating it and keeping it in the box. Now we have to connect it both the halves by pushing them together and ensure the dust cap is in place when not in use. The spacer is having a cap, so make sure that it is in use while it is in place when not in use. Then insert the inhaler firmly into the opposite end of the spacer. Shake the inhaler well for uniform distribution of drug and propellant. Then remove the dust caps from the spacer's mouthpiece. Tilt your head back slightly and place the mouthpiece in your mouth and seal your lips around it without biting. Breathe out all the way away from the inhaler and never breathe into the device. As you breathe into your mouth, press down the canister to release the dose into the space. Inhale slowly and deeply through your mouth. Take the spacer out and hold breath for 10 seconds as long as you you comfortably as long as you are comfortable. Then breathe out slowly. If a second dose is needed, wait at least 30 seconds to 1 minute. Shake the inhaler again, then repeat steps 6, 10 and 11. If you are using a steroid inhaler, patient is advised to rinse the mouth out with water and spit it out. Cleaning and maintenance. Clean the spacer once a week. Gently separate the two halves by pulling them apart. Before doing this, make sure that the inhaler is removed first. There is no need to cleaning the inhaler. Rinse both parts of the spacer with warm water. Mild detergent can be used if needed. Shake off any excess water and let the parts dry out completely. Store the spacer in a clean container. Next is patient counseling using rotahaler. This is the picture of a rotahaler. So rotahaler should be held like this as shown in the figure. It is having an upper half and a lower half, and also a hole is there to insert the rota cap. So both the halves should be fitted like this. Now a rota cap can be taken from the container and it can be inserted in the transparent end into the raised square hole. As I already discussed, there is one square hole is there. It can be inserted, or rota cap can be inserted into the square hole of the rotahaler. Press the rota cap firmly such that the top end of the rota cap is in level with the top of hole. Hold the mouthpiece firmly in one hand and then rotate the base. This separates the two halves of capsule. It can be seen through the body of inhaler. Then same as in the case of inhaler, the patient is supposed to breathe out forcefully. Grip the mouthpiece between the lips and seal the lips around it. Tilt the head slightly backwards. Breathe in through your mouth as deeply as you can. That is what we can instruct to the patient. Remove the rotacular from the mouth and hold the breath approximately for 10 seconds by counting fingers from 1 to 10. After you separate the two halves, discard the empty rotacap shells, reassemble the rotacular for subsequent use and insert a fresh rotacap. when for the next time. If a second dose is required, waiting for 30 seconds to 1 minute is very important. While care, remove empty shells from the square hole, rinse two halves the rotator under running water, shake well to remove excess water and dry. Avoid use of heat, reassemble into two halves for subsequent use. It's very important that it's very important that a cloth or any other instrument should not be pushed into the mouthpiece because it may damage the rota. Thank you.